Welcome to Integrated Medicine Perspective. I'm Dr. Wendy Liu. Diarrhea is a very common side effect of cancer treatments. Treatments with such a side effect include certain chemotherapy agents, radiation treatment to the abdomen and pelvis, surgeries involving the digestive tract, and most recently, immunotherapy with immune checkpoint inhibitors. Most often, the diarrhea is transient, but not uncommonly, it can become a chronic symptom. Diarrhea is not just an inconvenient or uncomfortable symptom. It means fluid and nutrient loss. It also means disturbances in the gut microbiota, meaning a gut microorganism environment. We now know our gut microorganism environment is very important to our nutrition, metabolism, and even immunity. As many as 40% of patients undergoing immunotherapy with immune checkpoint inhibitors suffer from diarrhea. Depending on its severity and response to treatment, diarrhea may result in discontinuation of treatment. So it is important to have an effective way to prevent and manage diarrhea. Unfortunately, at present, we don't have an effective way to predict or to prevent diarrhea. Clinically, the management of diarrhea mostly include fluid replacement and medications to help slow down the movement of intestines. Today, I wanted to discuss some of the evidence in food chemistry studies and some normal physiological factors that we can consider in a dietary approach for managing diarrhea. One of the considerations is the choice of fibery food. We categorize fiber by its physical and biochemical features. For instance, we categorize fiber into soluble and insoluble fiber by its water solubility. We also categorize fiber into fermentable and resistant fiber by its fermentability by gut bacteria. There are other features of a fiber that we can use clinically. For instance, different fiber has significantly different ability to hold water, and we call it a water holding capacity. So in the management of diarrhea, we wanted to use foods with fiber that has high water holding capacity. And for instance, potatoes and oats are the type of food with fibers that has high water holding capacity. Here, the potato, of course, are plainly cooked potatoes, such as boiled or baked potatoes. We're not talking about French fries here, because when potatoes are fried, they are saturated with oil, and their ability to further hold water or to hold oil is compromised. But unfortunately, food chemistry data about water holding capacity or oil holding capacity is not readily available for all of the most consumed foods. So clinically, I do use traditional Chinese medicine theory about foods that can enhance spleen qi or spleen energy. Spleen qi or energy in traditional Chinese medicine is most likely equivalent to gut microbiota in Western medicine. Examples of foods that can increase spleen qi are potatoes, pumpkins, and millet. Of course, individualized dietary plan during active treatment is dependent upon a person's nutritional status, metabolic features, and the digestive ability. So consulting a specialist would be necessary to help formulate a suitable dietary plan. Another consideration is about fiber or food's ability to bind bile salts, because bile salts are also very strong laxatives. Under normal conditions, bile salts are reabsorbed in the small intestines back to the liver for reuse. But when the digestive tract is affected by chemotherapy or immunotherapy, its ability to absorb bile salts may be compromised. So when a good amount of bile salts get to the colon, they become laxatives. But if we use fiber, especially viscous fiber, to bind bile salts, their ability to cause diarrhea is significantly diminished. Again, potatoes and oats are the type of foods rich in viscous fiber that can bind bile salts. Another important piece of knowledge is that fibers from raw fruits and vegetables do not have a good ability to bind bile salts, but cooking can increase their binding ability. So, in the management of diarrhea, I would recommend to avoid raw fruits and vegetables, except a banana, but to use cooked ones. Finally, our stomach acid is also a strong laxative. So in the management of diarrhea, I would advise to avoid drinking water, especially large amount of water or fluid on empty stomach. When the stomach acid is flushed further down the digestive tract, it can cause or exacerbate diarrhea. There are other fluids and foods that may exacerbate diarrhea. I won't list all of them here. But in summary, in a dietary approach to manage diarrhea, we can use foods to counter pro-diarrhea factors. Also importantly, when we have our focus on the management of diarrhea, we also needed to pay attention to the completeness and balance of nutrition. We also needed to pay attention to adequate intake of calorie, protein, and all of the nutrients. And individualize the dietary plan during active cancer treatment can be complex and even complicated. Again, I would highly advise consulting a specialist to help formulate a suitable dietary plan. Before I end today's discussion, I want to emphasize a point. The management of diarrhea is dependent on the cause. Not all diarrhea is managed in the same way. For instance, even diarrhea caused by immunotherapy-induced colitis is managed differently. Colitis meaning inflammation of the intestines. So when the intestines are very inflamed, their ability to handle fiber is compromised. In this case, we need to restrict fiber intake instead of increase them. Another good example is diarrhea caused by infectious colitis. The management will also be different from what we talked about, different fiber choices. But for people who have diarrhea or prone to have diarrhea, but without significant evidence of colitis or inflammation of the intestines, adjusting fiber type and the timing of fluid intake may help reduce the symptom of diarrhea. That's all for today. Please leave comments and questions, and I will see you soon.